Healthcare is extremely important in rural Nebraska. Research shows that if patients are allowed to recover close to home, it actually speeds up the recovery process. They're close to family, they're close to friends, they get to come visit them in the hospital and just makes them feel better.
5 minutes from my home and I'm right here. And when I've had both surgeries and procedures done, and my husband picks me up at the door and we go home in 5 minutes and I'm in my recliner.
Accessibility is important to the local community, especially in healthcare. Individuals sometimes will not seek out healthcare if it's an inconvenience.
It's great to have that communication and that follow through and to see how you impacted people in your community's lives. I feel that our nurses have a good impact on caring for patients. They see directly how that impacts families when they see them at church and at the grocery store. They know who they're taking care of and they realize the impact that they're doing for patients and their families.
And it gives them that opportunity to see that they've actually helped somebody and you know, they've actually helped other people achieve their dreams, whether it be, you know, a dad that comes in with chest pain and then they see him walking their daughter down the aisle.
You get to see impacts, not only on a daily basis, but also through generations. Like the chance that you're gonna treat a grandma and a grandpa and a mom and a dad and grandson, it's pretty high possibility. I think that's awesome.
I feel safe having such a great hospital so close to home. I feel like we don't have to travel a long ways to get great medical care.
Healthcare is really important everywhere, but in rural communities, it's the backbone of the community to a large degree. It often is the major employer. It often serves as a focal point for business and getting people to move to the community.
I'm a believer of this, that as healthcare goes, the community goes. A strong community allows for the growth of strong healthcare as well.
The great thing about working in rural communities is we get to make decisions locally. We get to focus on the community needs and we get to solve them locally.
I think that many community members are surprised at the services that we offer. We just keep growing and adding services.
The folks would be really surprised of the array of specialties that we have coming here at Box Butte. So for example, urology, general surgery, cardiology, dermatology, those providers all come here and see patients.
We try to say, why not, instead of we can't. We have about 23 to 25 physicians that travel to us for our specialty clinic, and that gives our patients a lot of choice and a lot of diversity.
Those people are the ones who are busy feeding our world and feeding us. Let's take care of them so they can continue to take care of us.
Our hospital provides for the community personalized care. I can't remember how many times I've heard from patients and family how thankful they are that they know the staff that are caring for their loved ones. Local health care makes a huge impact on the community. Healthier individuals, happier individuals.